Hi, everyone. My name is Zhao, and I'm a research associate with ECHO based at University Health Network, which is in Toronto, Canada. I'll be speaking on behalf of myself, my co-author and the fellow panelist, Dr. Maria Milopoulos. Together, we wrote a paper called What Role Can Education Play in Integrated Care?, in which we argue that the ECHO model is a novel digital health solution that uses technology-enabled learning to facilitate, support, and model integrated care education. And it was also a way for us to expand and contribute to the ECHO literature by creating a link between the ECHO model and integrated care. So what is ECHO? So ECHO is an acronym that stands for Extensions for Community Health Outcomes. It's a model for health professions education, where we use digital health as a means and platform for education sessions. So ECHO uses a one-to-many model where we have our academic specialists, and they work within usually an academic hospital, and they connect with healthcare providers across the province, in this case, Ontario. And our ECHO Concussion Hub consists of professionals across 9 different health disciplines, including medicine, pharmacy, physiotherapy, and occupational therapy. And not only this, our learners are also reflective of this multidisciplinary hub, attending from over 15 different health professions, from physiotherapy to family doctors to pharmacists and nurse practitioners in the community. And we've also had a few social workers as well as health psychologists attend our sessions. So we found that ECHO improves clinicians' knowledge, confidence in management of complexity and different patient cases, as well as developing a community of practice. So what does all this have to do with integrated care? What we observed in the integrated care literature was really a lot of discussion around the development, the implementation, the evaluation of integrated care programs, and even, really conceptualizing what is this topic and what is this space. But we didn't really see a lot of discussion around education of the healthcare workforce to be able to enable, support, and sustain integrated care once implemented. And even though ECHO isn't a program for integrated care or about integrated care per se, although I think there are some discussions with the Ministry of Health in Ontario around developing an integrated care ECHO, we did see many relevant links between ECHO and integrated care that we wanted to highlight. So this is really where we actually started to operationalize how exactly would ECHO as an education program really meet and interact with the integrated care model. So on the micro level, what we really saw was, in terms of clinical integration, the clinical integration really occurs through case-based learning, and this is through the patient case discussions that happen every week. Clinical integration occurs when learners move through productive struggle together and come to us beyond a single solution, developing a nuanced understanding of patients and their contexts. In terms of the meso level, so this is on professional integration, there's development of professional networks between clinics, as well as development of empathy. Something that we've heard is that when a clinician, so say for example, a doctor, hears about how a pharmacist in the community might manage a particular case and how they approach certain modes of asking around management and diagnosis, that really a deeper understanding of what each profession does helps foster this development of empathy. And now also, interestingly, in terms of organizational integration, this is where development of the specialist generalist occurs. And it's defined as the ability to support care for a wide range of patients in primary care settings. So you can think about this as the family doctor who's seeing not only the concussion patient, but also the chronic pain patient, also the Hep C patient, also a patient who's a refugee coming in and a newcomer to Canada, and also a development of stronger interprofessional networks within their own clinic centered around interprofessional teams. So this includes a family physician, a nurse practitioner, a registered nurse, pharmacist, perhaps an in-house psychiatrist or other medical specialists as well. And then all of these are then come together and again talk about the same patient, and they're able to work together in a stronger, more coordinated fashion. And then finally, in terms of macro level, the system integration, the education that providers are receiving, we really kind of cut across between primary care to quaternary care. And then through the establishment of lateral peer-based networks focused on population level health, this is where we see system level integration occurring. So just finally, one last point about integrated care education. The conversation that we think is occurring within the integrated care space is incredibly important and so useful in terms of the development, evaluation, implementation. But what we see is lacking is around this piece of, okay, how do we educate the healthcare workforce and perhaps the healthcare managers and administrators to be able to support and sustain the important work of integrated care?